So how do you stage this AKI? Stage 1, stage 2, stage 3. Stage 1, increase in serum creatinine as we discussed 0.3 milligram per DL in the past 48 hours, or increase in serum creatinine from 1.5 to 1.5 milligram per DL, or a drop in your urine output by less than 0.5 ml per kg per hour for 6 to 12 hours. If the creatinine is increased to 2 to 2.9 milligram per DL from the baseline, or there is a drop in the urine output of more than 0.5 ml per kg per hour for more than 12 hours, or the stage 3 contributes the 3 times increase in the serum creatinine value above your baseline, always remember above your baseline, or the serum creatinine value of more than 4 milligram per DL also contributes to stage 3 of AKI, or a decrease in the urine output of less than 0.3 ml per kg per hour for more than 24 hours, or an anuria, that is total renal shutdown for more than 12 hours. Remember, this staging is very important and is a very important question when it comes to theory exam or as well as your practical. So, always remember stage 1, stage 2, stage 3. The creatinine stage 1 1.5 to 1.5 to 1.9, stage 2 is 2 to 2.9, stage 3 is 3 times above, or your serum creatinine value being more than 4 milligram per DL, or when it comes to urine output criteria 0.5 milligram per DL drop in urine, 0.5 milligram per kg per hour for 6 to 12 hours, stage 2 is 0.5 milligram per kg per hour for more than 12 hours, stage 3 is complete anuria for 12 hours or less than 0.3 milligram per kg per hour for more than 24 hours of urine output. So, what are the other deficiencies? Other than the KDIGO guidelines, we have 2 other criteria, which is one is the rifle criteria, that is risk, injury, failure, loss and end-stage renal disease criteria, and the other criteria called as Acute network, which is the acute kidney injury network. But the most validated is obviously the KDIGO guidelines. However, we'll just have a look at what do these criteria define AKI as. So, rifle criteria defines AKI as increase in serum creatinine to 1.5 times the baseline. As we saw before, the first stage 1 also had 1.5 to 1.9. So, here it says directly 1.5 times the baseline. Or the rifle criteria also judges the AKI based on your GFR levels, that is decrease in GFR to more than 25%. Whereas in your Acute network, that is acute kidney injury network, there is an increase in serum creatinine to more than 0.3 milligram per DL, that as discussed before in the past 48 hours, or a 1.5 to 2-fold rise from the baseline in the past 48 hours. So, Acute network is more or less similar to your KDIGO guidelines, wherein here also there is a increase in serum creatinine to 0.3 milligram per DL in the past 48 hours, or the rise in the serum creatinine from 1.5 to 2-fold from the baseline in the 48 hours here it says. But KDIGO says that rise in the serum creatinine to almost more than 50% in the past 7 days.